to the heart, where we make sure all those actions actually connect to our feelings. You and I know that many things in life, especially in your childhood, unless it connects to it. So let's move AMR from the mind to the heart. The fourth, when we talk about hands, yes, we need money and we hold hands for that money for AMR. But let us also use that hands to hold others for partnership. Partnership not just between friends, but partnership with other sectors, partnership between countries so that the learning is transformative, if I can put it that way. And my last point. Tomorrow, and these last few days, you heard a lot of talk. Can we move that talk to the walk? And when I say the walk to implementation, where that desperate need for context-specific solutions in if we can do these 5 things, looking at our own body, I think we are well on our way on the road to implementation. Thank you once again for being here. And as we listen to all our speakers today, let us reflect and make sure that we have this chance. I always say to my students, I was formerly a teacher, antibiotics have saved us, but can we save them? Thank you very much.
Thank you so much, Sujit, for elaboration. I like the way you always summarize, 1 to 5. Sometimes we make it a 3, but it helps really to get everything in details. All right, Jacqueline, from the UNEP perspective.
Oh, it was working already. So good evening to all of you. And maybe I would like to start saying that every time I think of antimicrobial resistance, I think I know the numbers. And I said, okay, this is the number of deaths that it is expected that we will have. This is the consequences that, in a way, not acting will, we will have as the world. And every weeks we get more information about number of deaths, for example. Recently, you might have seen these new reports. In the next 25 years, we will have 40 million deaths expected to happen if we don't take action. If you put that into maybe concrete numbers, is 3 deaths per minute. Can you imagine 3 deaths per minute? And that's only if we are looking at antimicrobial resistance from the perspective of the consequences directly for the use of antimicrobials, of antibacterials. If we are looking about indirect, we go up to 170 million deaths in the next 25 years. I cannot even imagine those numbers put in some place. So scary, right? And I am sure that in the few months, we will get another numbers that are going to be not going down, they are going to be going up. So what have we learned so far? We have learned a lot of things, but we still have very primitive systems. If we look about the lack of sanitation that we have, waste treatment, water waste treatment is still not there in most of the countries of the world. Very, very poor hygiene habits. We have also access to antibiotics or antimicrobials together with access to vaccines, very scarce all over the world. So our healthcare systems are not top in the world. Maybe you have in some places very good facilities, but not all over. What I am describing today is not only a challenge for antimicrobial resistance, it's a challenge for poverty, it's a challenge for the Sustainable Development Goals. So taking action should not be that complicated. Tomorrow, we will be having one remarkable big achievement, which is the declaration, but the declaration is a starting point. We cannot really think that we will progress if we only have a statement. We have the hands to hold, as we were hearing here. We have the capacity to partner, and this is the people sitting here and you here is a very big evidence about that. And maybe to finalize and to end, I would like to refer to a study that was done by request of the Global Leaders Group, that it's talking about the cost of inaction, but it's also talking about the benefits if we take action. And there were 3 scenarios. The first scenario was the business as usual. I will not tell you the numbers because it's just doom. The second one was taking measures, but it was not going in depth into working together and in a partnership manner. And the third scenario was really catalyzing those actions and working strongly together. So what are the results of that? If we go with the third scenario and we really start implementing, for every single dollar that we put into those changes, we can get 7 of profit, or 13. That's from 7 to 13 US dollars. What I'm trying to say here is that if we really do the right things, we can not only phase out the problems that we are facing today with antimicrobial resistance, but it can also be helping growing. And this is not only a call for action, it's a call really for development, it's a call for growth, and it's a call for safety for everyone. So we have all the elements we need. We have everything that in a way can help the world survive, the human beings, because the environment will survive anyway, but us survive this antimicrobial crisis. So what are we waiting for? I think we have compelling reasons to really take action very, very strongly. Thank you.
Thank you so much, Dr. For thoughts. ADG Tanawat from FAO.
I think according to the topic of this evening, voice perspectives from small and medium income countries. All of you know very well that too often vulnerable groups, communities, people, marginalized communities, peoples, their voice are not heard. And that's why it's the same situation for, especially for small island developing state, seed or landlocked countries. Those countries, when you're talking about the situation that they need to face, not only AMR, all other issues the same, because they are the one who always got a lot of impact, socioeconomic impact, social impact. You can see that during the crisis of food crisis, during the conflict that happened recently, the food price increased double. And the one who impact most is the low and middle income countries. And that's why the issues of AMR, antimicrobial resistance, we know that in low and middle income countries, if you look at our farmers and producers as FAO, Food and Agriculture Organization of the United Nations, we are working on food and agriculture to make sure that we can produce enough food to feed 8 billion today, 8 billion people today, and 10 billion by 2050 is a challenge. And we know that small-scale farmers, small-scale producers, when the animal gets sick, when their fish pond or shrimp get diseased, even though today some of you may not know that, even though when plants get diseased, farmers already use antibiotics to treat those plants, orchard, trees. And that's why we know that in agri-food system, antibiotic use is enormous, more than 70%. And that's why today we cannot wait for political declaration. But tomorrow when we get the political declaration. We need to start our work immediately. And that's why together with quadripartite organization, with ICARS, how are we going to make sure that our farmers and producers know how to reduce the need? What innovation, what solution that we can offer? If we don't have solution, we don't have innovation, how farmers we can adapt themselves? Because if their animal going to die tomorrow, they need antibiotics. But in terms of overuse, misuse, underuse, it's another story. Because we know that in some countries, even though when people get sick, when farmers, their animal get sick, sometimes they cannot get access or even though cannot purchase antibiotics. But some place can get it easily. If you go to grocery store, you can get antibiotic already very easily. And that's why the issues sometimes is complex, but it's always have solution. And that's why at FAO this year, even though before tomorrow, in April, we already launched the Global Renofarm Initiative, reduce the need of antimicrobial on farm for sustainable agri-food system transformation. And just last 3 months, we just launched another initiative called In-Farm System, International FAO Antimicrobial Monitoring and Surveillance for Agri-Food System, to make sure that we can support our farmers. And even though before I came here, just on Monday, we just have the global conference on animal health, innovations, and vaccine. Because we need innovation, we need vaccine, which actually is a tool that can help us to reduce the need of antimicrobials. And I'm sure that all of you are here today, you will bring more solution. And for tomorrow, you will take more action. And I'm sure that after tomorrow, we will join our hand to make sure that we can work better to support our members, to make sure that our farmers and producers can produce better, to make sure that we will have a better production, and also for better nutrition, better environment, and a better life for all, leaving no one behind. Thank you very much.
Thank you so much, Tanawat. Thank you. ADG Yukiko, please.
So good evening, everybody. So yeah, I'd like to echo the colleagues already mentioning we have to take action. Really, that's the important. Also, we all are very exciting to the approaching the high-level meeting tomorrow. But yeah, there are something that today is the eve of the high-level meeting, so very important night to discuss on how we can take action more and then make changes the more effectively and impactful. Then I'd like to say they are highlighting what WHO will commit after the high-level meeting. So I'm thinking I'd like to share the two things at least today. The first one is WHO has been actively providing the technical support to country, but our resources is limited, and many partners having the limited resources, not unlimited resources is not feasible, it's not reality. Then that's why, so after the high-level meeting, so we need to emphasize of how important would expand the collaboration within the international global partnership beyond the current AMR community. So we need to encourage of the community on the outside the AMR, such as something the civil society advocating the cancer treatment. So, but the cancer treatment have to have the infection control. So otherwise, the cancer, the medicines, it's not effective. So therefore, such kind of the community that working on the global health, we have to encourage those community work on the AMR as well together with us. Then WHO now planning to convening the partners meeting closely with our main partner together. They co-organize those expanding the big partners meeting is coming maybe beginning of next year. But alongside that, we want to convening the smaller the partners meeting to making the brainstorm how we can encourage those partners on board to beyond the AMR community. That's the first thing that WHO want to commit. Then second thing is the investment round in the November. Of course, so we need to mobilize more resources to accelerate all the actions. We need to resources. Also, the WHO also need more resources ourselves. Then we organize the investment round in November during the G20 summit. Then this is the deep dive of the what WHO commit and what WHO can deliver of the AMR actions. This is the very new document just arrived last Friday. Then we bring this hard copy, the 100 hard copy here, not today here. So please see this document and please know about understand about what WHO commit and deliver together with the quadripartite partners organizations and together with all the partners and the stakeholders and the member states together. Then we need roughly 85 million for 2 years to WHO, including 3-level regional office and the country office to accelerate our actions, so including the technical support to the countries. So please see this document. So I introduced this document and saying the commitment. The things in the part of this, I would like to mentioning to the one thing about the integrated surveillance data system. So in terms of the advocacy and encouragement of the other societies to AMRs, so we need to demonstrate of the impact using the very quality data, such as the integrated surveillance data. That's bring to increasing the usability of those data to use for the improvement of the procedure and to reduce the prescribing the overuse of the antimicrobial, and also monitoring the progress of each countries, and then we can break down the target number of each countries to make sure that identify the prioritized of the actions in the countries. So the digitalization and using the AI is a really key issues alongside with the AMR responses as well. So that's the thing. So I'd like to emphasize of the take action, and they're similar, the same as the other colleagues. And also, lastly, I would like to say special thanks to the Kingdom of the Saudi Arabia will hosting the 4th Ministerial Conference in November to translate the political declaration into the actions. So thank you so much.
Thank you, Yukiko. Now, last but not the least, Javier, please.
Okay, so I was told to write something for 3 minutes, and I wrote something for 6 minutes, but I think I'm going just to talk for 1 minute because the stars and the people who deserve to be talking to you today are the LMICs representatives. They are the ones, their voice and the problem that they are living. AMR is hard in their countries, and I could even say that this is even harsh in some occasions. And as a partner of the Quadripartite, sometimes people ask me, who are the Quadripartite? What are you doing? And well, this is the Quadripartite. If you have any idea or if any complaint, this is us. You can talk to us. We talk every 2 weeks. We sit on the table for 2 hours and we put every item in the agenda. And we discuss and we exchange and we try to coordinate actions. In the political declaration that is going to be discussed tomorrow, there are a couple of elements that I would like to highlight from the animal health perspective. And one is, and I'm going to read it so I do not destroy what the member states have been negotiating for more than 3 months, is that the burden requires global solidarity, joint efforts, and international cooperation. This is part of a commitment of the political declaration that will be discussed tomorrow, and we are very happy to see that because international solidarity is a must in containing AMR because this is a global issue. In terms of animal health, maybe you know that the tagline of our communication department is animal health is everyone's health, and maybe you wonder why they are saying this. Well, you have to know that land food animals support the income and livelihoods of 1.7 billion people around the world. And it goes the same for those depending on aquatic animals, it's 800 million people. And this is for food production animals. But you also have to know that 1 out of 2 households in the world has pets, is living with a cat or a dog in close proximity. Very, very close proximity in some cases. And this is why animal health is everyone's health, because we are sharing the same environment and we have to maintain the ecosystem in a sustainable manner. As an international organization setting standards, what we do is defining how to use antimicrobials in a responsible way. And I have to read another commitment from the political declaration, which is that member states commit to ensure that the use of antimicrobials in animals and agriculture is done in a prudent and responsible manner. And in that sense, I'm glad to share with you that during the last general session in May 2024, the 180 member countries approved by unanimity the updated version of the Chapter 6.10 for terrestrial animals on how to use responsibly antimicrobials in animals. This is completing other documents that we have there for member states, such as the antimicrobial list of veterinary importance and the recommendations of that list. The recommendations on that list are the most important part because those are the ones who are saying how to use responsibly antimicrobials in animals who have been defined by WHO in collaboration with us and with FAO of those who are medically important for animals. I have to say here very clearly that in these cases, the use of those antimicrobials for growth promotion is not responsible. One thing we are very happy about the political declaration is to see the prevention, the word prevention. Our colleague from FAO, he was talking about Rhinofarm. Rhinofarm is about prevention because prevention is the best way to use antimicrobials responsibly because we do not need to use them. And in that sense, we are very happy with another commitment, which is by 2030, animal vaccination strategies with an implementation plan should be established in every country. So bravo for this commitment. We are here to support those efforts. And as I said, the quadripartite is us. If you want any question or whatever, here we are. And thank you very much holding my hand to ICARS because partnerships and collaboration. Thank you very much for this. And as he was saying, just take actions from the mind to the heart and let's save antimicrobials for generations to come. Thank you very much.
Thank you so much. Thank you so much. So a big applause to the panel and please get back to your seats while we are welcoming another esteemed panel for the keynote remarks. Thank you so much for sharing those excellent thoughts. I would like to call Honorable Dr. Jo-Etienne Abella, Honorable Minister of Health and Active Aging Malta. Please welcome Dr. Abella, the Minister of Health in Malta. And thank you for Malta as well for the strong leadership role you played in this whole process. I would equally want to recognize and call for His Excellency Francois Jackman, the permanent representative of Barbados to the United Nations, sorry. Warm welcome to him. And apologies if I mispronounce your names. Your Excellent State Secretary for Development Policy, Minister of Foreign Affairs of Denmark. Warm welcome. And Mr. John Kariuki, who is part of the WHO Task Force of AMR Survivors. Please welcome. And we'll start with you, Honorable Minister, for your key remarks.
Hello.
Yes.
Thank you. Thank you, and a very good evening to you all. Following months of discussions and negotiations into the high-level meeting process, a central ambition of the political declaration is reducing global deaths associated with bacterial antimicrobial resistance by 10% from the 2019 baseline of 4.95 million deaths. This is significant. It is a tangible goal that drives the commitments in the declaration. By 2030, all governments are expected to have developed, updated, and implemented national action plans based on the One Health approach. The political declaration sets a financial target to mobilize at least $100 million to support the achievement of funded national action plans in at least 60% by 2030. This augurs well towards addressing the long-standing concerns that guided and drove the negotiations towards these targets. Global solidarity through a broadened donor base, supported by the mapping of funding practices, will be useful in assisting countries, especially the low and middle income countries, to access available financial and technical resources and support. As co-facilitators of the high-level process, Malta, together with Barbados, has sought to engage with as many stakeholders as possible, ensuring that each country's position was heard. This helped us go beyond what existed in the previous declaration and to push for more ambitious, bold, but achievable commitments, whilst maintaining balance and keeping the text within the reach of all concerned. The role of the Quadripartite Joint Secretariat has been and remains pivotal to this process, more so as a driver of the implementation, especially with respect to the mandate to set up the independent panel for action. These networks and dialogues built around the high-level process over the past months have created an excellent opportunity and platform for country collaborations, continued dialogue, and exchange of country experiences, lessons learned, and best practices. These can be adapted culturally as necessary for optimal outcomes towards our common goal. Whenever we are in the world, regardless of geographic and socio-economic barriers, every patient, every citizen should have access to antibiotics that work. This is essential for controlling AMR, to improve health outcomes globally, and ensuring that life-saving treatments remain effective for the future. Once again, a big well done to all concerned, and thank you for listening.
Thank you so much, Honorable Minister. Your Excellency Jackman.
Thank you very much, JP. So I have three very simple messages, excellencies, colleagues, friends. First, a message of thanks to the QJS, to organizations like ICARS and others represented here today. Thanks to you, the co-facilitators, my colleague Ambassador Fraser and I benefited from constant flow of advice, suggestions, wisdom, and experience. Sometimes it felt like too much, but it was always useful. And as the minister highlighted, we did our very best to be always available to it, because we found in our role as co-facilitators that it was incredibly valuable to hear these voices from all of you. And I hope that you will find some of what you told us communicated back to you through this political declaration. So really a heartfelt thanks to you, because whatever is in that political declaration, it's certainly the work of the member states, but it's also the work of the AMR community. Secondly, and I think Ambassador Fraser would agree with me here, Minister, a word of apology, because we wanted to have a 2-page document with bullets, commitments, and actions. And we gave you 106 paragraphs and 15 pages. So sorry, but we hope that in there, and the minister and others have already referred to a number of the important targets and commitments and principles that have been highlighted. We hope that in those 106 paragraphs, we have, with the member states, provided enough meat on the bone that between now and 2029, between now and the 81st General Assembly, when there will be a review, we can work towards some of these commitments and some of these targets, even though you have to sometimes read between the lines to find them. But it's a UN document, 193 countries. You can feel our pain. The last thing I would like to offer is, and because it's the theme of this evening's discussions, is kind of a narrow LMIC perspective on a specific issue of concern, certainly to my country, which is a small middle-income country, but I think is very important across the board for developing countries. The minister already mentioned it. It's the finance targets. There's a target in there which says we will try to reach at least $100 million of financing. And it's a target linked to the national action programs, national action plans, linking the achievement of this target to the achievement of at least 60% of countries having funded national action planning. And I think the $100 million is a symbol. It's a tiny sum in an ocean of financing and efforts that is required. But it's an important symbol. It's a marker. It's the first time we've had such a marker. And we certainly hope that it will help across developing countries, across financial institutions, across research institutions, across philanthropic organizations. It will help to crystallize what it is that we're after here. I'm confident that we will blow past this $100 million in the next year, far less the next 5 years. But I'm really hoping that it will serve as a catalyst for the community, for the member states, for the partners to meet and really go past this target. And in that regard, and this is the final point, I think the fact that the document is now much thicker and fatter than we'd hoped will be useful, because you can take it and bang on the doors of the financial institutions, of the partners, and say, listen, you committed to this in this political declaration. Let's get it done. Don't let us down. And we have a mechanism to see, a review mechanism for what will effectively be 2027, 2028, and another go at this in 2029 with another high-level political meeting. So I hope that we've been able to put into this political declaration enough that will give the majority of lower and middle income countries both the ambition and the means to meet the ambition. Thank you very much.
Thank you so much, Your Excellency. No, I think you did a good job, and 15 pages are still manageable. And I think the purpose is to make it heavy to bang on those multilateral financing doors. So thank you for great work for you and Malta as well. I would welcome Your Excellency, Ms. Lot Marshall. Apologies if I mispronounce your names. And thank you for the Danish government for strong leadership and support in AMR. The floor is yours.
I don't know. Oh, wow. There it came. Good evening. I hope you're awake. At least you are now. It's an impressive turnout at such a late hour. It's great to be here and be in the panel. So thank you to ICARS and to the Joint Secretariat. You're doing amazing work, and we are happy to be here. But first of all, of course, I want to thank the Honorable Minister and His Excellency, the PR, for their amazing job with the negotiation of the draft political declaration. I hope it is indeed heavy enough to bang on doors to make sure that words are put into action. So it's not yet another document up on a shelf with dust, but actually one that makes a real difference in the world, because the world needs it on this particular subject. Because AMR is one of the most urgent global threats. We know it. It's a threat to us all wherever we live in the world. But in so many crises, it's often those that have the least or are the most vulnerable that are affected the most. And thus we see that over the last couple of years, in fact, over the last 2 decades, alarming numbers has been growing in lower middle income and least developed countries. And I think what's important to underline, it's not only a health threat, it's an economic threat, it's an environmental one, it's a social one affecting families, societies, and countries as a whole. So we've seen the global response is too weak, too fragmented, and hence we need to scale up responses and accelerate what we're doing, especially in the lower income countries and lower middle income countries, and actually do it in partnership with the countries concerned. Therefore, I am also very happy on behalf of the Danish government to see that the One Health National Action Plans are at the heart of the declaration to be voted in tomorrow, with clear commitments to develop, update, and implement the appropriate financial support, which the PR from Barbados so laid out very clearly. I think you said financing 3 times in a row. We got to remember that. So I can say that the Danish government is committed to contribute. As many of you know probably, that in collaboration with the World Bank, we established the International Centre of Antimicrobial Resistance Solutions, ICARS, in 2019. And we heard it from Dr. Shandy, the Executive Director of ICARS, earlier on the important work that is now being done in ICARS. Three points in your mission: to support and partner with the low and middle income country governments to develop, secondly, evidence-based and cost-effective solutions, and thirdly, to respond to specific challenges as expressed in the AMR National Action Plan. It is really important, the work that you are doing. Can I say that maybe over the last 5 years, ICARS has established itself as the leading organization? That's at least what we proud ourselves with in the field. And it is through your partnering with government across the globes, and many are actually represented here tonight. We still believe, though, from our side, that the potential is untapped. And we know that ICARS are on the outlook for more partners, and maybe some of you will feel inspired by tonight. At least I hope so. Finally, we hope that the declaration has provided the political momentum, given this is a critical agenda, and that we will now join hands and actually try to tackle what is one of the most urgent health threats that we are faced with. Thank you very much.
Thank you so much. Thank you so much. Thank you. Mr. Kariuchi, over to you.
Good evening, everybody. All protocols observed. Like everybody suffering from constraints of time, being asked to give 1 paragraph, they end up giving 30. I'm supposed to give my personal story in 3 minutes. This story was a year-long story, and I hope that after the story, it that will buttress the sentiments that have been shared here, looking like theory, and now try and make it really look practical. So my story began on 20th of October 2020 when I had an accidental slip and fall in my bathroom, and that occasioned a fracture of the hip joint, which was initially misdiagnosed in a hospital in Nairobi. And it's only after craniotomography, computerized craniotomography, that we realized what the problem was. And the recommended intervention of a surgical intervention was done on the 18th of November, the same year. That was a few weeks later. But after that, I never recovered. I was a sick man, even after being given the first-line generation antimicrobials. And I was hospitalized after that, and 5 hospitals were involved. More than 5 orthopedic surgeons were involved. We involved over 6 physicians, highly qualified physicians, and over 10 caregivers in trying to find out what the problem was. And I went through 11 units of blood transfusion because of the illness, which was very severe. And at the same time, I underwent multiple therapy of all sorts of antimicrobials that were available and were believed to be effective. And after 5 months of hospitalization, I was released to go home, still very weak and unwell and with infection in blood. And you can imagine, having taken myself to hospital, this time I was released on a wheelchair, debilitated, unable to walk, and could only be supported to the bathroom. I started recuperating from that time of after 5 months in hospital. And I had a professional wound dresser who would come twice a week. I had also a full-time nurse sleeping in the same bedroom with me. And this wound dresser would come and clean up the wound using iodides and then go away. And after 5 weeks, I had to give him his marching orders. And in August, 2 months later, I managed to engage a laboratory, and we did an AST, that is an antimicrobial susceptibility testing. And the results that came out showed that out of 18 antibiotics tested, only 1 was working. And so we decided to bite the bullet, and we used that antimicrobial despite problems associated with it, which include toxicity to the kidneys and to the ears. And after doing that, we stopped dressing the wound 4 times a day. Started slowing down. We started dressing it 3 times a week. The following week, we started dressing it twice a week. And then the following week, we started dressing it once a week. And by the mid-October, we were dressing it just once a day. I again took another AST towards the end of October. And by 4th of November, I had recovered. The wound had become sterile. And it was just after administration of the correct antibiotic following antimicrobial susceptibility testing. That word always gave me a problem, even in college. So I prefer to use antimicrobial sensitivity testing. But you can see that took a whole year. That is almost a whole year after the first surgical operation. And I recovered in time to participate in the World Antimicrobial Awareness Week of that year and to give a testimony on what AMR can do. And you can see the impact of the AMR, both health-wise. I used to be a very good soccer player. I used to play with my children. And I used to do all the tricks in football that you see nowadays. Don't think they've discovered something new. It's something we did those days. And now I can only watch my children play and tell them that they do not know how to do it, how I used to do it. I'm not praising myself, but you can see the impacts, including mental impacts, thinking about yourself as an inferior human being because of what happened. I acquired a new walking style thanks to a 3-inch reduction of the length of my right leg. I do not want to undergo another operation because out of the 18 antibiotics that were tested, only one was effective. And that was that time. So what about now? Is that single antibiotic effective? So dare I go for another open surgery? I beg to differ. You can see other issues like pecuniary affairs. I incurred a hospital bill of about 35,000 US dollars. That was a direct pecuniary implication. What about the indirect, which involved loss of income, loss of daily adjustable life years, etc., etc. So you can see the effects. And that kind of money probably could have been put into sinking a borehole somewhere, 1 or 2 boreholes for a community to provide wash facilities. I'm glad that I'm a member of the WHO Task Force of AMR Survivors. And in that task force, we are really focused on advocating for AMR, using the catchphrase that AMR is invisible, but I am visible. You've heard a lot of stories about AMR. Now, when you look at me, just see it now and let it impact in your mind that it can happen to you. It can happen to anybody. We are all vulnerable. There are no vulnerable groups. It's the scale of vulnerability that is there, but we are all vulnerable. It can happen to you, to me, to anybody, anywhere in this world, because the bacteria are global in nature. And the WHO task force is bringing out that narrative and humanizing the issue and making it more patient-centric. And if you want to know more about the WHO task force, we have a QR code, I think that can be provided, where you can go in and see what we are doing as AMR task force. So briefly, that's my story. If you want more details, I'm available, and I thank you.
Thank you so much. Thank you for sharing your personal story and as well to the task force. And again, a big applause to the panelists, to the people who gave us the keynote speakers. Thank you. Now, the next session, we're going to hear from the countries. And I would like to call Sunita Narayan to come and moderate the session. And just as a matter of a handover, I'll tell you that I did a poor job in terms of managing time. I count on you to correct all of that. And Sunita is a member of our Global Leaders Group on AMR, as Dam said, and Scott, as I said before. And she did actually convene a similar workshop back in April in India in discussing almost the same. So naturally, we thought Sunita could be good to manage this as well. So warm welcome here, and we're looking forward to discussion. Yeah, sure. Yeah.
Dr. Islam is the Deputy Director, Animal Health of the Department of Livestock Services in Bangladesh, so neighboring country. Dr. Ethel Marcel, Secretary of Health Surveillance and Environment in the Ministry of Health, Brazil. Welcome. His Excellency Dr. Sambat, who is Secretary of State, Ministry of Health in Cambodia. Please come, Dr. Sambat. Welcome. Dr. Chavez, Technical Secretary of the Multi-Sectoral Commission in Peru. Hello, please come. Dr. Aziz, Director, Pharmaceutical Services in Ghana. Dr. Aziz, yes, good. So as this is a very important session, because it's a session for us to really understand the challenges and your expectations. The question for all of you is the same. What do you see as your key priorities, the challenges you face in implementing them, and of course, the expectation that you have from UNGA and beyond? So, Dr. Islam, start with you. And as JP has told me very politely that he was a bad chair, he has basically told me I better crack the whip. So it's going to be 5 minutes each.
Okay. Respected moderator, respected participant, good evening. I would like to say regarding the AMR issues in Bangladesh perspective, and I would like to go regarding the structure questionnaire that supplied us earlier. Yes, the Bangladesh has a good coordination regarding AMR as a multi-sectoral platform on health issues regarding the animal health, human health, and also aquatic life. And also we try to integrate the agriculture sectors and also environmental sectors under this AMR platform. Regarding the national strategic plan, we have a national strategic plan that was formulated in 2020-21. And recently this year in 2024, we updated this plan and also the approved by the ministry, especially Ministry of Health and Family Welfare, and also Ministry of Fisheries and Livestock. Yes, and also regarding the costed budgetary plan, this is yet to formulated. Actually, this is the LNA job by the respective department regarding the Department of Health Services and also Department of Livestock Services. They have the job to costed plan. Yes, the activity that is mentioned our national plan, this is the specific regarding there is a different activities included in animal health activities and also the human health activities and aquatic health. There is a separate activities included in our national plan. What are the priority intervention regarding the AMR issues that arise about, it's not a decade ago? So the activity that is run in Department of Livestock Services mostly ad hoc basis, especially for the development of trained workforce. We are conducting the continual professional development through the government ongoing projects, and majority of the activities are run by the development partners, especially FAO, Fleming Fund. They are doing this good job in our country regarding the training program, and also the FAO that run the BARA program, Bangladesh Animal Health Antibiotic Resistance Alliance. They are promoting the antibiotic awareness program in our country. Also, the Fleming Fund recent time, they have established the laboratory capacity regarding the AST testing. The several laboratories in animal health sectors, they are refurbished, and also the laboratory and training activities they have conducted, and they are conducting the surveillance regarding the also in poultry sector. So this year they also are taking the activities in also dairy sectors in the AMR issue. So they are working in our AMR issues in Bangladesh. We are doing the good farm practices. We have recently developed a good farm farming practices, especially in the large scale and medium scale farm. We also banned the antimicrobial growth promoters in the poultry feed formulation, and also banned the critically important antimicrobials that is used in human health. We already banned especially the colistin also banned in animal health. And also we have a AMR sectoral working group, and we quarterly we sit in this meeting. We have discussed the progress in the quarters and also way forward. So we discuss in this meeting also. Yes, there are many challenges in our country. Actually, the AMR financing in animal health sector is very sparse in our country in recent time. we have a densely poultry population, small farms. These they're gather. They are a very little distance they are located. So especially the antimicrobial is mostly used in small scale farming. Especially the sector 3 poultry farming, there is a antimicrobial mostly used because they are driven by the middleman. So this middleman is the contributing factor to AMR in a country. And also in a case of our country, there is a multiple organization involved in the regulation of antibiotics. There is a DGDA and DLS. So there's a conflict of interest in our country. I would like to say in last point, the expectation. I would like to learn more from the low and middle income countries where they are using the practices and intervention. We try to scale up this activity in our country perspective. Yes, thank you.
Very well done. Excellent. Thank you, Dr. Islam, and thank you for such a clear positioning and also sticking to time. Thank you. Dr. Marcel, can I now call upon you?
Thank you. As I have only 5 minutes for so many challenges in Brazil, I try to put our priorities. So I will highlight 2 main priorities in this area. The first one is to increase the access, especially for vulnerable population in the Amazonia region. We have more than 300 ethnicity in Brazil, and some of them there is a very recent contact of the indigenous population with non-indigenous population, and for this population, we don't have labs in close place. So what we are doing, going to actions with our priority. The President Lula launched a accelerator plan for building some laboratories in areas that we don't have in Amazonia region, and have 5 mobility labs with biosafety in this area. We will have for the first time in Brazil the biosafety level 4 that we are right now building in Campinas, São Paulo, and we are doing some bio-level 3 in some specific areas in Brazil that we don't have. So this will be more than 3 billion reais, which will be 1 point something billions dollars to this initiative that we are doing right now. So this is a priority because we need to have a very good lab to have a fast diagnosis and treat. Because one thing that we realize that there sometimes takes too long to people get the results. So this means, as your powerful speech, this means life and life and death. And the second priority is for us to integrate data. We have a very good data for human in the health area, but we don't have the same as the quadripartite say here. We don't have the same data in a public environment for farm and animal. And we launched one health committee with 11 institutions and minister to combine and integrate data. This was last month. It's a very new in Brazil. And this is a very important challenge that we have, because we have a very good regulation for human, but you don't have the same regulation for farm and animals in Brazil. So right now we are discussing together, because it's not a problem only in the health sector, but it probably is not different in other countries. We are usually work in our own box, so health sector, environment sector, and right now we are working together in this committee, and this is what we are putting as the 2 priorities. And for this second priority with this integrated data, we already are doing a very important job with the Minister of Environment and Climate Change, which is Ministra Marina Silva, and the Minister of Health, Ministra Anísia Trindade, that we are working we just launched a sharing data in air pollution. And right now we are working in the water, because the environment make one part of the job and the health make another part, and now we are integrated data. So this is what we are doing, going to the declaration that we work very hard to have tomorrow, to concrete actions in Brazil. And in the G20, only to summarize, we put the declaration of climate change, One Health approach with focus specific in AMR as our priority from the G20 presidency. So, thank you very much.
Dr. Sampath?
Thank you, Madam Coordinator. May I respect excellencies and everyone. I thanks to ICARS and quadripartite organizations to support AMR. For Cambodian experience in 2019, the Royal Government of Cambodia launched its first multi-sectoral action plans on AMR, reflecting the One Health approach to collaborative interventions to address the AMR threats. The multi-sectoral approach was jointly prepared by Ministry of Health, Ministry of Agriculture, Forestry and Fisheries, and Ministry of Environment, encompass 7 strategic areas to address AMR in human health, animal health, and environment. Even though the implementations focus on the project for stronger collaboration among government counterparts, there was also coordination with other projects and events. For example, the UK Fleming funds, which ensure energies complementaries of technical and financial resources, thus preventing duplication, and also strengthen governance through formation of multi-sectoral AMR technical working group, which is under endorsement and establishment of an inter-ministerial coordination committee for One Health in late 2023. This action highlights Cambodia's strong leadership and political will to drive AMR initiative across the sectors. Even though I would like to touch on some of the challenges, as I repeated and I showed you the last 2 sessions, significant lack of awareness and understanding of the impact of AMR and limited capacity, including among healthcare professionals on all aspects of AMR, AMS, AMC, and AMU, although this improved during the lifetime of the project. In addition to awareness, building capacity across sectors is vital. Training is needed for healthcare professionals, including infection prevention and control measures. I also wanted to reveal that, what Cambodia expected from UNGA, and UNGA should add in Cambodia's national AMR efforts. 2 points that I would like to raise. UNGA can and should highlight the important and coordinated multi-sectoral action plans based on One Health approach. The second, we hope that UNGA will, galvanize international cooperation to support Cambodia's new multi-sectoral national action plan that is currently under endorsement. Thank you.
Dr. Chavez?
Thank you. Um, First, I need to thank all the committee and other organizers. Thank you very much for giving the opportunity to be here and to share all the progress of to address AMR in Peru, and it's possible to this experience try to extrapolate to use for another countries close to Peru, no, in Latin America. Peru recognized that the antimicrobial resistance is a great threat in the global health. This is an important challenge that needs to be addressed under the multi-sectoral and the multidisciplinary action. And it's very difficult. Everybody here know that it's difficult to work with different sectors, different ministries, but it is very important to address this multi-sectoriality. And that is very important to think locally or act locally and think globally. No, all the efforts that we make in our countries probably will be helpful for another countries closely or around the world. Peru has taken some concrete steps in addressing to the AMR problem. In the 2019, Peru approved the National Action Plan to address antimicrobial resistance by a supreme decree that was signed by the Peruvian president and 7 ministries. And this was very important because include different ministries like agriculture, health, and another ministry like a production, for example, that is very important in Peru, that is a producer and different products and export different products in essential. This action plan is based on the One Health approach that is based on the WHO Global Action Plan, but it actually is currently in process to update it under 2030. Peru also in this Supreme Decree approved the Permanent Multisectoral Commission. This is the Plan Action Committee, and that is very important because now include 11 ministries, include the academia, the research institution, and professional college. And actually for the next year, what we include another group of interest, like a producer, for example, or local producer. This group is leading for the Minister of Health. Actually, I am the secretariat, technical secretariat. Peru considered that this address the antimicrobial resistance is essential to stress the surveillance. It's very important for us to produce data, evidence in order to generate policy based in evidence, specifically evidence from our country, from our local reality. It's essential to promote the responsible use antimicrobials, guarantee the supply, and have an adequate network of microbiological laboratories. That is very important, specifically in developing countries. Probably it's a really gap the laboratories in general, specifically in microbiology. In Peru, this is very important, the human health. We have a lot of experience in human health laboratories of microbiology, but the problem is in another sectors, for example, in agriculture and animal health, that's probably don't use simple technicals, phenotypical technicals for antimicrobial resistance. This is very important for us to concrete these aspects. In recent years, we have different implementation. Sorry?
I will ask you to look at it from the point of view also of what your expectations are.
Okay. Okay, in recent years, we have different cooperation projects on AMR, but I think this is no, it's only for a short period. Like this cooperation projects probably give us the seed budget in order to start in the implementation of initiative around AMR. But it is necessary to that the countries to implement and reinforce for example, the framework in policy and also in the budget, the local budget, in order to guarantee the sustainability in our countries. Well, finally, in developing countries, I think it's necessary to reinforce this national policy and the budget framework to guarantee this sustainability. I think this is very important because all of different initiatives needs money, needs guarantee a framework of policy and governance that is very important, specifically in developing countries. No? That is my appreciation. Thank you.
Thank you, Dr. Chavez. Thank you very much. Dr. Aziz.
Thank you very much. Good evening, all. I would also like to say a big thank you to the Quadripartite and ICARS for giving me this opportunity. I would like to acknowledge the presence of Dr. Mrs. Martha Jansalutrot, who has led the AMR activities. She has actually helped done so well within this space. I cannot help but acknowledge a round of applause for her. Ghana has, like most of the countries here, has a national action plan. In fact, has a national AMR policy and a national action plan, which is costed. I think one of our strengths in our implementation is good leadership, political will, strong political will. Indeed, soon after 2016, when there was a call to action for the first time on AMR, Ghana was one of the first countries that developed a NAP. And it was actually launched by the president of Ghana. Our NAP prioritizes intersectoral collaboration in the spirit of One Health. We also are very, very particular about strengthening systems. In fact, our NAP looks at strengthening our surveillance systems, establishing antimicrobial stewardship programs, looking at IPC, and other activities. What are we doing currently? There's so much, and I feel like looking at it from a 1 to 5 points, I will do my best. As I speak with you, very, very fortunately for us, we have a lot of donor support, and I'm grateful for this. There's so much that we are doing. Under the CW Palms project, we are strengthening and establishing antimicrobial stewardship programs in selected hospitals, and this is very actively being done. Another thing that is ongoing is that we have research and development. NAP pays attention to research and development. So for instance, thanks to ICARS again, there are two very important projects ongoing in Ghana. One of them is helping us to look at cost-effective ways of reducing surgical site infections. There's also another one called HotMat, also being supported by ICARS. And under this project, we are looking at assessing the level of antimicrobial resistance in selected sites in the city of Accra, which happens to be the capital city. We also have developed, with assistance from the WHO Ghana Country Office, guidelines to look at, to help us strengthen our lab systems. And this is happening in the spirit of One Health. So we are doing this within the environment sector and also within the animal health sector. We have various trainings ongoing. We are looking at helping our poultry farmers through a project that we call the School Field Projects. And through this project, we are actually teaching our farmers to be able to use antimicrobials very, very, very effectively. One of the things that we've learned along the line is that we realized that we were paying too much attention to activities that had to do with the animal health. So moving on, we had a midterm assessment, and based on the recommendations, we actually paid much attention to activities outside the animal health, outside the human health. So for instance, now we have a lot of activities ongoing that are targeted at the environment, human and other sectors. In Ghana, one of the key cliches that we hear is leaving no one behind. And we are truly walking the talk when it comes to moving no one behind. We are actually, as I speak with you, developing standard treatment guidelines for the animal sector. This is something that I don't think many countries have done that. So it's a plus for us. We have done the WHO aware classification, and this is impacting on how we even choose antimicrobials onto our standard treatment guidelines. In fact, there's a lot going on. Within the 5 minutes, I think I would move on. What are our challenges? I think Ghana as a country, we are very, very interested in system strengthening. And so one of the things that we've done is to strengthen our systems across the health sector. And we've had challenges with funding, but I'm happy to quickly say that very recently, we've had a lot of donors coming on board. In the past, it was just WHO country office. Now we have USAID coming on board. WHO through a COICA collaboration is even helping us to establish antimicrobial stewardship programs. CW Palms have come on board, and they are doing so much with the AMR stewardship programs. And so there's a lot going on. What have been our challenges? Initially, it was funding, but I'm happy to say that that has really improved. One of the things that is confronting us now is collaboration and coordination. This is one of the challenges. And having listened to, my panelists here, I realize that it cuts across. It's something that we are really paying attention to, because at the end of the day, so much happens, but what happens to coordination? Data collection is also one of our key problems. I'm also happy to say that with support from Fleming Fund through the Orum projects, we have established a data collection system. And as I speak, Ghana is reporting to the WHO GLASS. Yeah. So what are our expectations from this high-level meeting moving on? We are expecting that we'll have more of such fora, because it is through this fora that we learn from one another. This is one of our key expectations. We're also looking forward to collaborating and being given more opportunities to give people the chance to learn from the good work that we are doing in Ghana. We also hope that when the next call to action is, announced, we'll have support, both financially and in training human resource to be able to take up the challenge. For lack of time, I think I'll rest my case here. Thank you very much for the opportunity.
Thank you, Dr. Aziz. Thank you. I think what's very clear is what we hear is clear commitment from every country to make sure that the One Health approach is integrated into the plans, into the way we move ahead. I mean, Bangladesh has already taken the lead to do what is now required through the political declaration as well, to put aside the critically important antimicrobials for human, not to use it for animals. I think there's huge leadership that we are seeing from all countries of the South, from LMIC. And it's very clear that as we move ahead, the challenges are what also get pointed through the political declaration. And I would like to thank Ambassador Jackman, because I know how much work you and your colleagues have put in. And I think it's a very important political declaration, because a lot of the ideas that we have been talking about are now there on paper. We talk about One Health, but we still did not understand how to actually implement it. We still don't know, but that's a work in progress, and we will continue to do more in it and share experiences. But now, as part of the political declaration, it's very clear that it has to come together. It's very clear that the challenges of human health are critical when it comes to antimicrobials. But it's very clear also, and I'm really delighted to see that for the first time, the political declaration does emphasize the need for prevention, does emphasize the need for us to look at our farming systems so that we don't have to use antimicrobials. And that for us in the South is very important because we know we need cost-effective ways to be able to reduce the use of antimicrobials. We cannot afford to pollute and then clean up. So for us, clean water, sanitation, doing farming so that we don't have to use antimicrobials is the way for us to go ahead. So the declaration points to all these things that need to happen. And I think what we've heard today from this amazing panel is that there is clear commitment, there is a clear roadmap that they have, and what they're really looking for is more, much more collaboration, sharing of information so that we can keep learning and keep doing more. But thank you very much, and a big round of applause for the panel. Now, in your very able hands.
Thank you. So we're now going to move from low and middle income to donors. That's not to say that high income countries don't have problems. Let me invite my panel. Commissioner, please do come and join me. Dr. Tam, Mr. Daesh, I always call you Rakan, come and join me. And Magnus, please. Can I give you that? Thank you. Now, we're running late. I'm hoping there's some drinks and food out there. And so we're not the last thing between it, but we will try and keep this fairly crisp. I will echo Sunita that I think we've got at the end a great political declaration. Thank you very much, Francois and Vanessa, for your leadership in all of this. It covers everything. Now it's time for delivery. And we know that the low and middle income countries can't do it on their own. So I'm inviting each of you in turn to consider some issues around being development partners. How are you going to help National Action Plan implementation in low and middle income countries? And how can we address the financial gaps after this? As well as what are our expectations post UNGA high-level meeting? And if you don't talk about action and you talk about more talk, then we've got the wrong panel. But I know you all, so I know it'll be action. Commissioner.
Thank you. I don't know if that was quite a powerful way to start. First of all, thank you. I'm really happy to be here. I think that, as you said, that tomorrow's political declaration it really does include actions from all nations to have national plans for AMR into place, but also to implement. And it is important that the quadripartite will also update the global action plan to ensure that we are having a One Health approach. And One Health is a concept we've been hearing a great deal about over the last few days. This is why we, as the EU, welcome the call for more contributors to the Multi-Partner Trust Fund. We're already contributing with over 18 million euro. We're also contributing to the Secure initiative to provide access to antibiotics, as well as reinforcing surveillance and data sharing and increasing laboratory capacities. But I believe that this is only part of the solution. And what I would like to say is that even though we can discuss, as Dame Sally Davis said, what are we in terms of funding and financing, I just want to say that we need to make sure that already existing financing streams are used effectively. And that we have to be very careful that we don't create a situation when we are using and putting in and financing in a way that is going to be less effective. So I think that that for myself at the moment is one of the most important challenges that we have to do. So I think that mapping the existing financing streams is important in order to allow low and middle income countries to make the best use of them according to their needs. And I'll stop here.
Thank you very, very much. The EU has long been a leader in AMR, and your contributions to the Multi-Partner Trust Fund are very generous. Magnus, World Bank, what are you going to do?
Action. Action, I think, is the right answer, right?
Spend the money wisely. Yes.
No, so thanks for the opportunity. I think it's a true sign of commitment that we have so many people here at almost 8:30 in the evening, the day before the big day. So the first thing I want to say is that the World Bank is fully committed to supporting countries and regional institutions to address AMR based on a comprehensive approach across sectors. Our last portfolio review concluded that we have active commitments of approximately $2.6 billion to support the AMR agenda globally. We see the national action plans for AMR as critical. They have been important for guiding action and for identifying financing needs. Having said that, they represent a vertical approach, and looking at the extent to which national action plans are financed presents, in my view, an overly bleak picture of the state of AMR financing. I would say the glass is half full rather than half empty. In a lot of meetings this week, we've heard that addressing AMR is about strengthening health systems, including WASH, health workforce, laboratory surveillance, and so forth. We fully agree, and we're seeing significant volumes of support on these agendas, as well as in agriculture and One Health. This financing does not show up as commitments to finance national action plans, but it's very much in support of the AMR agenda. I think a similar picture would hold if you look at either other financing sources, whether MDBs or global health institutions such as the Global Fund. And I think this raises some important questions about how we should think about AMR financing and AMR financing gaps. Having said all this, the glass is still only half full, and I think there's scope for both international financiers and governments to do better. On the World Bank side, we can do better by systematically integrating and mainstreaming our AMR in health and agriculture projects. And this is something we're actively trying to do by implementing the recently launched Framework for Action and by leveraging partnerships. And in this context, I should say this is a framework of action that we developed with support of the Danish government that was very much appreciated. But it's governments that implement World Bank projects, and AMR also needs to be mainstreamed at that stage so that AMR financing needs are considered when decisions are made about how World Bank financing or financing from other partners are being used. So in sum, I think there are reasons to feel positive about the AMR financing pictures. The global advocacy efforts around AMR has done a lot to create awareness and understanding of the challenge and what needs to be done. It'll be critical to continue to generate data and build evidence of what works, both to sustain support to financing and guide prioritization. And if we can demonstrate progress and continue to mainstream AMR across sectors, I'm confident that financing will follow.
Magnus always talks good sense. So Magnus, I've got some more things to ask you. You can clap him when he's answered these. No, you're not done. You're never going to be done from me on AMR. Will you label all your expenditure where it is related to AMR, whether sensitive or more general? Because we actually do need to know what's going to the AMR sensitive or AMR specific.
I feel like there is only one right answer to that, but I
And the right answer is you're going to look at it because you'd like to do it. And you're going to try and take all the development banks with you. Yeah?
Yes,
Yeah.
something
Good.
like that. And I recommend
Okay.
you speak to Ajay.
I'll speak to Ajay. Right. The next point you didn't specifically pick up, and yet I know that this is true. There's quite a lot of money for pandemics, preparedness and general preparedness, and a lot of that can be applied for, can't it, for AMR, which is after all a silent invidious pandemic. Could you just give us a minute on that so people are aware?
Yeah, so there's a lot of support for AMR. We have $1 billion project in West Central Africa, $1 billion project in East and Southern Africa that supports PPR. And PPR means surveillance, workforce, labs, all of the things we're talking about in relation. So I don't think AMR is part of those projects. The issue with World Bank projects, and I think for a lot of financiers, is that these are frameworks. The details of what we end up financing, or the government end up financing using World Bank resources, that is determined through annual work plans, through procurement plans, and that's where the AMR agenda needs to be reflected, and where the people from the Ministry of Health, the Ministry of Agriculture that are driving the AMR agenda need to be around the table in the room when decisions are made about.
We're going to have to do a little manual for countries so they can see what they have to do. I rely on you to help me make it happen. Good. So now we move on to Teresa. Teresa, the questions are your reflections and perspectives as a development partner on AMR NAP implementation, and how can we help LMICs?
Great. Thanks, Team Sally, and thanks, ICARS and the Quadripartite Joint Secretariat for this opportunity. I was really inspired, I have to say, by the lower middle income country panelists. Yeah. And also, of course, by the patient stories, the AMR narrative, because to get funding, you got to capture the imagination of political decision makers and finance ministers. And I think having the patient voice is really important in that context. It is complicated, right? This multi-partner, One Health, everybody sort of engaged approach. And so it is not easy, and it's not easy for Canada. That's why I was thinking some of the stories from LMICs are really inspiring. I think what post the necessarily long political declaration, very important, we should really try and get this sort of knowledge exchange, I think, mechanisms going, as the representative from Ghana was saying, you know, we would love to share our story. So I think the multi-stakeholder partnership platform under the Quadripartite is going to be an important mechanism. We in Canada would certainly like to hear from others, and that could be on anything to do with the national action plans, because the implementation is the difficult bit after you get the thing on a piece of paper, whether it's on access, poor incentives, surveillance, IPC, etc. So I think there's lots to learn from each other. I think the second point I wanted to make was that the political declaration really notes the importance of leveraging the existing global funding mechanisms, some of which you just pointed out, whether it's the Pandemic Fund, the Global Fund, or others. So I think the key is having sustained and predictable funding for AMR initiatives. So accounting for it is actually quite important, but to sort of figure out where it is sustainable, particularly for LMIC countries. There's a couple of initiatives I want to point out, but by no means are they the most important ones. There's many of them. That's why mapping, I think, is important. We were one of the first global partners to contribute to Secure. And I think we were really impressed with that mechanism because it is fundamentally about expanding equitable access to life-saving antibiotics, which is extremely important to low and middle income countries. And in 2023, we announced 6.3 million investment in CARBEX. That's an important mechanism because that is sort of pulling together nonprofits and other partners to try and accelerate the development on the antimicrobial products. So I think that there's so many mechanisms that mapping will be really key.
And I do think integrating AMR efforts into the broader health system strengthening, as many people have said, is really important, which also perhaps gives us an inroad to leveraging existing development funding.
Thank you very much. So Rakan, you come from a really rich country. And I don't think you have a history of development funding. Yet you, your vice minister and your minister have all assured me you want to help on AMR. So what are you going to do?
Well, thank you very much, Sally. It is a rich country, but however, also implemented the National Action Plan and have funding allocated in the budget, which is an experience that we are happy to share on how we have done this. We're one of the 11% of the countries who have implemented budget financing for AMR. So I think we're utilizing the status very well, and hopefully we can share experiences. And in fact,
forgive me, that's internal. We're talking about helping low and middle income countries.
Exactly. So this is why I think I'm using my experience from my previous role in the Ministry of Finance more than my role now in the Ministry of Health, because what we need now is to engage more the multilateral development banks. We're speaking, for instance, with the Islamic Development Bank and with the World Bank, just to make sure that there is an outcome from the fourth ministerial meeting, which will be hosted in Jeddah. So I think there is a gap of finance.
Is that your money you're trying to spend or their money? I'm trying to spend their money. I want you to spend your money.
Well, we are contributing. We are a major contributor to the World Bank, and we sit in the board, and we can impact the agenda, and we can deliver development finance from the Islamic Development Bank, which Saudi Arabia shares more than 50% of the Islamic Development Banks. And we sit in the board of the World Bank, and I think we can contribute to the governance of the decision making there. So therefore, we see the lack, and we see that the low and middle income countries are in a very much need of financing. You alluded to the role of the pandemic fund, and we see how it contributes to the low and middle income countries. Saudi Arabia is part of that. Saudi Arabia is also a G20 member country where we represent also the voice of the emerging and low and middle income countries. So I think we do have a bigger role to play, and this is why we're joining UK and other countries to take more leadership role in terms of mobilizing development finance.
So you've heard it here, a bigger role.
Exactly.
Well done.
Thank you.
Before you all escape, I just want you to give me one hope for after the high-level meeting. What do you hope is going to change?
Well, we wanted to make sure that it is from declaration to implementation. So we wanted to see implementation plans come out from that, and we ensure follow-up from the Troika proposal that we are proposing.
Which, as you know, I support. Teresa, one hope.
Well, implementation to action needs monitoring. So I think looking at how do we track progress.
Nice one.
For us, I think it's a framework for action. We're at the implementation stage. It's a long sort of slog, because it's really about reaching out to the regions, convincing the countries, convincing our teams to take this on. So I'm hoping to see success of that.
Great. Stella?
One hope. Tomorrow's an important day, but it's a big step, but it's a step. And my hope would be that out of tomorrow comes implementation, but that out of tomorrow comes the determination that we keep this at the top of the political agenda. Because all we're talking about in financing and how much we are able to offer, if it slips off the top of the political agenda, we are not going to be able to achieve what tomorrow's declaration actually puts down. So my hope is that we leave no one behind as we move forward keeping this at the top of the political agenda.
As so often, I can't better what you've said. I agree. Thank you, panel. You're wonderful.
Thank you so much, Sally, and the panelists. Great job. And we can already see the linkages of the two panels, and that really gives hope of where we're heading. Now, we still have, at least in the room, a few minutes before we hear from Dr. Hanan Barki for closing. So I want to check if a delegate from India is around to speak. Yes, please. Okay. Just,
So I thought I don't have to speak, so yeah. Hello, everyone. So I just want to share, because it was a collaborative meeting between Quadripartite and ICARS. So I had prepared an intervention as requested, and I wanted to share that something that we've been pushing for right from the last 5 years, that the One Health approach cannot happen if each sector doesn't have its own plans. So we, as a part of the NAP2 National Action Plan, AMR 2.0, we have pushed each sector to have budgeted action plans. So we realized that if animal health doesn't have a lab on its own, human health can't do their work. It's not sustainable, and they will never be able to develop their own evidence. And as I shared today in the morning, that we have 2 big global reports in 2019 and 20 this year, which have come 2022 and this year, but there is no national capacity yet. So when my policymakers ask me, where is the data validation? Is that your data? What about your data coming from the country? So those are the areas where we want to work on. One is each sector contributing, and we really wanted to request the Quadripartite to also have national presence, because in the country still it's the human health which is taking a lead. We're not having animal sector still is on board, and environment sector is still, kind of saying we have a lot on the board. They're keeping AMR off. And the other thing that we wanted to request was the Quadripartite support and building national capacity, so that all the statistical modeling that's happening in these global publications, and we want to bring down to, we want to reduce by 10%, but if we, at the country level, I can't see what is my data, any global report will not impact my policymakers. So those are the 2 requests I had to the Quadripartite. Thank you.
Thank you so much, India. And we have as well the youth in the room, Dr. Wong and Mr. Baron. If you could quickly move those young people and really come and address us quickly, 1 minute each. You've heard what different people have said, then you're the future. And 39 million is a hope, or a hope is not going to happen with you in charge. So 1 minute each, please.
Thank you so much for this opportunity to share a little bit more of insights from youth. So we are both from the Quadripartite Working Group on Youth Engagement for AMR, and it is a very interesting discussion for sure. And we talk a lot about National Action Plan, and Augusto will share a little bit more. But from my side, I see that education is something that you can work on and to bridge the gap. We see a lot of initiatives out there, but there still need a more organized approach to education at all levels. So for us, we do a lot of community engagement, which that's the part that we can really have more like education for different peoples using different creative and interactive methods. And actually, we also created a youth manifesto leading up to this UNGA that we stress the importance of trainings on like skills to prepare like young people for all these initiatives. And I think that another thing that we also do a lot is to be a part of the community-driven microbial stewardship program that we can actually bring in different things through like behavioral changes, like small things like washing hands, preparing food safely, and getting vaccinated. And I think it's all these small steps that will also contribute to the national action plans, which means that now that we have hopefully we have a plan, and we bring in that to highlight how everyone taking all these small steps will contribute to our fight against AMR.
Good evening. Thank you so much for these wonderful interventions. I had a whole theme planned, but you know, time management is becoming a chronic illness. Coming from a low and middle income country myself, I've witnessed firsthand the constraints that we have when it comes to financial and logistical constraints when we're trying to develop and implement this sort of health interventions. And we get sometimes so focused on trying to problem solve these interventions and of solving this center of the issue that we sometimes lose perspective as well on how equally important is the peripheric of this issue in order to be actually effective on it. And one of these missed opportunities that I believe is to foster, well, in the framework of AMR, is to foster to raise public awareness on AMR as a critical issue and as a national priority. When we close the doors, and we have that opportunity to keep the door open from the very beginning of the NAP development to gather that, to center that attention. In my own experience, I didn't have that chance. I heard about an NAP being developed in my country. And I heard that it was going to be published at the end of this month, but as far as seeing it, reading it, having an opinion on it, not a chance yet. And many other youth and many other civil organizations have an interest in that. I know that at least youth, youth makes part of that, holds that interest. And it has been stated throughout the many statements that have come through, I think, the worldwide voices that have been put forward by statements such as the Youth Manifesto on AMR. Leave no doubt that youth is there with the interest, ready to take on the challenge to be part of that development. So as wide as AMR might be in terms of the difficulties that plague it in order to build an integral action plan regarding it, we must not leave behind every single component of what makes effective one of these policies, because at the end, the most effective policies are the ones that people actually care to follow. So by bringing people into it from the first instance, which is the development, puts us forward in that sense. So thank you very much.
Thank you so much. Thank you so much for the youth working group. Let me now call upon Dr. Hanan Balki, who is our WHO Regional Director for Eastern Mediterranean region, but our former boss at the AMR division. So glad to have you, Dr. Hanan. And the floor is yours for closing.
Good evening, everybody. And I know that we're a bit delayed. Good afternoon. And it's a true pleasure again to be with old and new friends and colleagues. JP, you did a great job with the Quadripartite and the whole team. I could probably mention the names of most of the people in the room. So I'm very excited that I'm here. Martha, it's great to see you. Very good to see you, Sabiha, Sally. This is for me, I'm sitting there and I'm extremely proud of the significant progress. Yukiko, I didn't see you. Nice to see you.
I think this event and the whole week at UNGA and all of the antimicrobial resistance events that have taken place is just to say how much effort has taken place and brought us together to discuss some very difficult topics. Of course, as Sally said, she wants money on the table, she wants action plans funded and work moving forward. But I think over the past 8 years since 2016, and a bunch of us in the room were on the IACG committee, and a bunch of us actually submitted the IACG report to the Secretary General here in New York. And now we see a lot of progress on the national action plans. So I think maybe we take a moment to appreciate our work and feel good about where we have. I personally need to thank my team. The work that took place in Geneva from 2019, when I became the first ADG for the AMR division, established the Quadripartite Joint Secretariat that was hosted at the WHO with the amazing team with different levels of the Quadripartite, and they've done amazing work. The Global Leaders Group, which came out of the IACG recommendations, where Sally and Sunita, I think she left. Oh, there you are, Sunita. And Sunita's on it again. We had several events where also Mia Motley, the Prime Minister, was there. That was the voice that also brought that political voice to the antimicrobial resistance. And that was extremely needed, and we need to continue with that. The partnership platform, which is housed in FAO, is active. It's moving forward. I'm super happy to hear the colleague who gave a face to AMR, and you gave a detailed story. You got me back to my bedside days when I used to round on patients that were colonized or ill with at least 2, 3, sometimes 4 bugs with multi-drug resistance. It's not an easy task. And as an infection control preventionist, communicating to the surgeons, to the intensivists, and I'm talking about a high-income country issue. So I think these are all issues that we faced, and thank you so much for being here. Bringing that team together was also not easy. So again, seeing you in reality and hearing your story is a step forward. There's so many issues that I can reflect on, again, because I think I was involved in many of the work that has taken place. But I want to thank the 2 ambassadors. Thank you for all the work that you've done to make this resolution so strong, with targets, with commitments. It could not have been done without your dedication. I want to reflect on a few critical things because it's about the expectations of the high-level meeting and moving forward. And there's work that was done that is probably not visible to everybody, and I want to highlight it. The financing issues of the national action plans, we have worked really hard in the Quadripartite to create the language for AMR in the pandemic fund that was part of the World Bank. The organizations, including WHO and the other organizations, have been working hand in hand with member states to make sure that AMR is being asked for, and funding for AMR National Action Plans is part of some of the applications that were going forward. And also, that was not an easy task. It took us a lot of work. We've created an annex to the UNSDCFs, if I hope I remember it, JP, this time, the United Nations Strategic Development Corporation Plans. I think I got it right. Frameworks, yes, thank you. Framework. And that's to create the fiscal space and the funding at the national level for AMR. And that was done not just by Quadripartite, but by more than Quadripartite agencies, so that they have the right tools in their hand to identify the areas that need to be funded for antimicrobial resistance. Of course, Sally, Liz led on that before she left us. She did a great job. We also worked with the Global Fund to ensure that they do not silo some of the critical pieces of TB, HIV, malaria, which is their biggest agenda, but to make IPC a basic national program that's a comprehensive program. And we've had lots of discussions with Global Fund, and they've also have supported that. So that just gives you the idea of how much technical work needs to go into place. We need to be owning this process at all levels. I find one of the means to promote this further is bring the accountability to a higher level. It's not about that single IPC that runs around in many hospitals on their own. It's about the CEO of the hospital. It's about the going higher and higher, and then the same issue within the animal sector. What we're hoping in the ministerial conference, that again, there will be some more explicit actions that will come. I hope that all of you can come to the 4th Ministerial Conference. I'm a bit biased. It's in my hometown. It's where I grew up, in Jeddah, Saudi Arabia. So I hope that everybody can join from the different ministries, and that we can see a lot moving forward. We used to say in health, leaving no one behind. And again, being the regional director of a region with significant conflict, I have to reflect on the importance of the conflict areas, and specific what I've seen in Gaza and in Sudan and many of our other member states. Gaza specifically has demolished and almost leveled health infrastructure with sewage running in the streets. That is your perfect storm, perfect incubator for multi-drug resistance to emerge. So again, as I've been saying repeatedly, without peace, we will not be able to suppress or mitigate or even bend the curve a little bit on antimicrobial resistance. So I say that again, we need to bring peace to the conflict zones, and we need to understand that these conflict areas are going to bring back all of the work that is taking place on antimicrobial resistance decades behind, because bugs do not know borders. I want to end with a bit of maybe of a positive in leaving nobody behind. I was telling to my dear friend Sanjit that maybe we should leave nothing behind, because it's not just about humans, it's the environment and the water and the animals and the plants. So with the AMR Energy, with all of your great work, I'm so grateful, I'm so proud, and I think that this amazing network can even grow stronger. I wish you a wonderful final days at UNGA, and thank you very much.
Thank you so much, Dr. Barki, for a rallying call for all of us to stick together. And the best way to start that, we have a very well-deserved reception on the back of the room. And we thank you so much for staying such late. And we wish you to have, we wishing you a very good and present day tomorrow, discussing the political declaration that Ambassador Francois and colleagues have led us to have. And we all, again, appreciating your effort, Ambassador Francois. Thank you so much, and see you soon.